If someone comes to me and they're like very perimenopausal, they're like, I have worse anxiety, my rage is out, I'm lashing out at my family, my skin is dry, like the things, I'm like, let's get your sleep better. African American women have more cardiovascular issues. They have longer and more severe perimenopausal symptoms. They tend to have more frequent and severe hot flashes and night sweats, which is correlated with cardiovascular disease. For instance, smokers for sure go into perimenopause earlier. And as I'm sure you guys know, it's not great for your skin at all. I like to address sexual health a lot because I feel, that a lot of this comes up a lot in our 40s where our hormones are sort of, it's funny because I feel like we have no problem addressing sexual health with men, but when it comes to women, we're like, have a glass of wine or like, just take a bubble bath. And like,
bubble bath.
I think that we don't often address the fact that testosterone and estrogen both are really important for libido, arousal, and sexual health.
Yeah.
And so as you lose these, it's very common. It's not just because someone thinks common doesn't mean you have to deal with it. It is not as always a quick fix. It's not so simple like as, I prescribe FDA approved medications for libido and I prescribe testosterone, and it doesn't, that in combination with making sure you feel supported in your relationship. I mean, making sure you're getting along with your partner and feel connected to them, and stress management, but it's hard. Like there's so many things that we're dealing with. So, and then sleep. So I have to say, like, if I have to pick one thing, like if someone comes to me and they're like very perimenopausal, they're like, I have worse anxiety. I want my rage is out. I'm lashing out at my family. My skin is dry. Like the things I'm like, let's get your sleep better. So I think sleep, because if you can get sleep better, it'll make it improves everything. As you know, like even skin health, right?
Yeah,
for
sure.
Yes.
For sure.
Tell me more. I need to work on that. What are your tips? I need all your sleep tips.
Yeah. So the sleep tips are basically, because I think like in our 20s, we had all these hormones that kind of covered, like you could drink all night, you could drink Diet Coke and coffee right before bed, and then you'd sleep like a baby. African American women have more cardiovascular issues and more they have longer and more severe perimenopausal symptoms. They tend to have more frequent and severe hot flashes and night sweats, which is correlated with cardiovascular disease, because every time you have a hot flash, your cortisol jumps, your blood pressure jumps, and your heart rate increases. And so that's the thing about that happening over and over again. It actually results in higher risk of cardiovascular disease. On the flip side, Asian women tend to have more osteoporosis, osteopenia, bone issues, joint pain. And so, yes, it's definitely genetic and sort of, connected to like your background.
What about environmentally, though? Because I'm sure in this day and age, everyone is concerned with the environmental impact, especially the food that we're eating, the hormones in those foods, and your milk and your dairy. And are you seeing a difference than maybe your older colleagues when they were seeing patients and going through menopause? Like, are you seeing a change where people are going through it differently, or maybe earlier or later?
It hasn't, believe it or not, it hasn't shifted in terms of the average age in like the last decade or so. And it's hard to say because I feel like now we're identifying perimenopause. Like even when I was a resident, I didn't identify it. I sort of got into this space because I kept seeing these 40-year-olds coming to me with these recurrent complaints. And I shouldn't even say a complaint because I feel like it's more like some, symptoms and the classic thing that most OBGYNs do, which I was doing, was putting them on a birth control pill, which is not wrong because women in perimenopause, most of them need contraception. That will help suppress the ovaries and the fluctuating hormones to some extent, but it generally is not going to help with the sleep and mood issues that they were coming to me for. And I started becoming pretty acutely aware that like what I was doing wasn't really helping them. And so I started getting really interested in like going to conferences, reading a lot about it and like nerding out on this. But to answer your question, there's some definitely environmental things that can influence it that are pretty obvious. For instance, smokers for sure go into perimenopause earlier. And as I'm sure you guys know, it's not great for your skin at all.